Chris Hani Baragwanath Hospital, Tina begins her overnight shift in Ward 20. She will be the only senior doctor on duty tonight. And in this ward, the work never ends.
There's 6 cubicles essentially. 4 of them are run by medical doctors. One's a high care facility, and cubicle F is our psychiatric facility. Pretty much casualty screens through here, brings all the medical patients through here, and then we sort them out. You're the doctor, you're the nurse, you're the student, you do absolutely everything. We put drips, we put catheters, we wheel patients around, we fetch scans, we pretty much do anything. And you actually get used to it, and you get pretty good at being quite efficient. Average day is about 150 admissions to this area, and that's looked after by about 8 doctors. So the workload is enormous. We service about a population of 5 million people. I don't know which ones you want to see. These are all chronics. Yes. We train our interns here, we train students here, we train foreign doctors here. Ward 20, if you want to learn, this is where you come and learn.
She's a good wretch. She loves her work. She gives it her best, basically. That's Tina for you. She goes all out for it.
If they learn something from me and they can tell me 20 years down the line, hey man, you taught me something, that's cool.
Kambule, I think it's you in the corner there. He's an 86-year-old gentleman who's presented with a 3-week history of cough, a bit of shortness of breath over a very short distance, and some loss of weight. Het jy al ooit TB gehad? Die TB, wanneer?
1957.
Kom iets uit as jy hoes?
Ja.
Wat se kleur is dit? Is dit green? Is dit groen? He's had TB before, and he used to smoke quite significantly. Just on history, I'm going to be looking for cancer. Lung cancer is actually very rife in our population. Main reason for that is that people wait too long before they come to hospital. By the time they get to us, it's already advanced and late. Can you see the pitting that I'm getting in the leg? He's got edema in his lower limbs.
Along with all the standard tests, HIV testing is routine for all patients at Baragwanath.
I'm going to have to do an HIV test on him. Age is not a criteria here at Bara. You see HIV from birth up to the oldest patient I've seen is 100. You see, in Ward 20, we do what we can on admission, because otherwise to get stuff done later is always a bit of a mission. So everybody gets x-rays, bloods, we do as much as we can. But the main thing in Ward 20 is just organisation, having stock of stuff. We often run out of stuff. I would love more doctors. Would love more space.
On top of managing with insufficient numbers of staff and resource shortages, Tina is struggling to deal with more patients than she can cope with.
Sister, what's happening here? We haven't got any space left. When we phone through with distress calls and say that we're busy, please try to not send through patients that are not urgent. They kind of don't really heed our warning. A lot of these people are not that sick. They can be seen at clinics, and then they send them to us in the middle of the night. So I'm going to phone and have a word with the casualty officer. The urgent directs I don't mind, but all this chronic nonsense is just backing me up, and I really have no space left. And it's 12:30, you know, we've got another 8 hours to go. Where am I going to put the really urgent patients? I said they didn't know.
Tina is worried about a young girl who's just been admitted.
This girl, I honestly don't know what's wrong with her. So I'm going to have to get an urgent brain scan. All I know is she's pale, and she's confused, and she's got some liver dysfunction. Usually by the next day we kind of have some idea of what's going on with these patients. But she's really sick and can't attend to her fully, which is very frustrating. I've got an urgent direct next door. I'm going to go there. This is for that guy. Yeah, must I leave the file there? Okay.
Tina is called away to diagnose another patient.
Pretty much we're trying to rule out meningitis. So we're going to just put a small needle in the back. This is usually done under local anesthetic. It's equivalent to an epidural, except with an epidural you go into the layer outside, we go into one slightly inside to that. And the fluid that comes out is clear like water, unless it's very infected that it's yellow or it's bloody if there's a bleed. You see why we prefer to use local. Sorry, sister.
Lack of resources prohibits the use of local anesthetics for such a procedure. Already overloaded, this is an added frustration for Tina.
Sometimes we struggle like this. So I'm just going to try and make it easier by sedating her. Every now and then, you just get humbled by a procedure. It's just one of those things.
Before Tina can finish the diagnosis, she is told the young girl she saw earlier is in trouble.
She's already dead. So when did you notice? How long ago did you notice? She had platelets of 7, with a hemoglobin of 4. Looked like severe sepsis. We did what we could. She had no chance. I just come too late. She's demised. She's already cold. You know, it's actually bad. Some of them you feel and some of them you don't. This is one of those where I knew she was going to die, so I was already prepared. I just didn't expect it tonight. I thought she would die tomorrow. C'est la vie.
It's halfway through the night shift in Bara's Ward 20, where most of the hospital's seriously ill patients are admitted. The staff has just dealt with the death of a young girl. It's the middle of the night, but things are never quiet here for long.
Yo, mama!
I'm going to give you something now for pain. I want you to relax. I want you to relax. Hi, AB, you're being a drama queen. You were fast asleep 10 minutes ago. I don't want you to scream, please. You're making everybody upset. AB, you're not a child. Don't scream. You're making everybody upset. I'm getting you something for pain in 5 seconds, okay?
Okay.
Tina moves on to check on a woman who has HIV.
HIV is just one of those things that's rampant at Bara, and there's very little that's being done, and we are so past the boat. We're in serious trouble in South Africa. This lady's got renal failure, kidney failure, basically.
The woman's condition has deteriorated quickly.
It's not looking good. Let's just discuss with the renal doctors if they're going to do any dialysis.
Tina calls a specialist to discuss the woman's case.
We've got a patient here who's a known renal patient, Louise. She's HIV positive.
Because the woman is HIV positive, she will not qualify for dialysis at Bara's renal unit.
Okay, thanks, Chuck.
Without dialysis, she has no hope of survival.
Hello, how are you feeling today? You're feeling
As
fine?
the night wears on, Tina makes her way through the patients needing her attention.
You're not feeling short of breath. Where's your oxygen?
Yeah, but I was red.
Yeah, but you need it. You're blue, ne? Your lung is destroyed on the right. You've got one lung and you get used to standing for 15 hours without a break. It's very commonplace at Bara. The left lung is damaged. You understand? Just a bit tired, hey? Every time you're on night duty, it's like this. You have to double check yourself because you tend to make mistakes.
Mama, yeah! Mama, yeah! Mama, yeah! Yeah!
A nurse arrives with painkillers, bringing temporary peace to the ward.
I've got a patient who's on a ventilator and he's not doing so well. He took an overdose. His family was quite distressed. He's not doing well. He's ventilated and he's not waking up, which is a very poor sign, but we're going to push on at least for 24 hours before we make a decision. That's kind of our policy. We do see many suicide attempts, various age groups, white, black, coloured, no class. In South African society with stress, we don't really cope well with it at all. So people just have to have some outlet. And taking tablets or landing up in hospital, it seems to do the trick. Now it's 7:15. I'm supposed to be ready to walk around with my patients in half an hour. And all I can actually think about is breakfast.
just need to eat something.
Okay. So we're just going to lift him straight up. My interns worked hard. They worked really hard, which is nice. Do you want to try from there? Or do you want to let me just go? Okay. Pneumonia, bed sores, meningitis, TB. Pick an option. He's got all of them. I'm just exhausted. What can I say? I'm only human. Still thirsty, eh? So we must just keep... we really don't work for the money. People who think we do have got the wrong idea. Medicine, you work because you love it. You do often end up staying here quite late every day, and it does sort of get under your skin. What's your name, sir? Every day I feel like I've done something well. And if it's just I help just one person, and that's enough for me. I love Bara, I love the people, I love the way it works, I love the way it doesn't work. And I think if it ran well, I wouldn't appreciate it quite as much as I do.